Hello and welcome to my presentation. I am Arita Samudo, a doctorate student in the Department of Public Administration at the California Baptist University. I will be speaking about Canada's prison reform due to COVID-19. The stakeholders in this presentation, which is about Canada's prison reform due to COVID-19, are the prison inmates, the correctional services workers, the medical and healthcare professionals, the prison reform advocates, families of the inmates, attorneys, and all other stakeholders and stake seekers who are directly or indirectly affected by the response or lack of response to the COVID-19 pandemic in the prisons in Canada. The Canada Prisons reform due to COVID-19 has been necessitated by the outcry from prison advocates, parents, families, and loved ones of the inmates in both the provincial and federal prisons in Canada. This has been due to the outbreak of the pandemic in some of the Canadian prisons, both provincial and federal prisons. As such, measures have been taken to curb the spread of COVID-19 across Canada prisons. Some of the measures include the attorneys being asked to avoid jail term where possible, facilitate early release for certain offenders, medical leave for inmates on day parole should be extended or has been extended from 15 days to 1 month, the advocacy of early release of inmates who are within 30 days of their release dates, and providing temporary absences to inmates serving intermittent sentences. Even though the program, which is the prison reform, Canada's prison reform due to COVID-19, is aimed at carefully containing the spread of COVID-19 in the Canadian prisons, as well as protecting the correctional service workers and other stakeholders, the federal government has been slow to act. For instance, the response from the provincial prisons include the province of Ontario and Northwest Territories have reduced their prison population by 25%. The province of Ontario has released nearly 2,500 prisoners and has tasked a dedicated team to review candidates for early release. In the province of Alberta, they're in the process of turning a wing of one of the prisons into a provincial quarantine zone for provincial inmates. Other provinces, including Saskatchewan, Nova Scotia, and the likes, have continued to forge ahead to put measures in place, such as testing their workers and the inmates, and having the inmates comply with safety hygiene by using hand sanitizers and soap, which are provided free of charge. On the other hand, the federal response hasn't been great. To date, we have no notable actions taken to decongest the prisons. A total of 91 inmates and correctional officers have tested positive for COVID-19. Almost half of these cases are in British Columbia, and that is at the Mission Institution. This has forced the entire nursing staff to stay at home quarantined. Canada's prison reform due to COVID-19 is an essential program across all Canadian prisons. It is therefore advisable that the measures be implemented by both the provincial and federal prisons. This is to safeguard the life and human rights of the workers and inmates, as well as all other stakeholders. Thank you for your time. Thanks for listening, and I hope to speak to you again. Thanks and goodbye.